Hello everyone.
Let's talk about effect of stroke. It's a very important topic with respect to the NEET PG as well as the other, even in the theory part of the medicine. So we all know what are the effects of the stroke, like whether it is a cerebrovascular accident or stroke, a person will get certain type of symptoms. But in NEET PG, they question about, like say, they will provide certain symptoms, collection of the symptom, and then they will ask you what is the name of that collective symptoms, syndrome name, or which artery is getting affected. So we will try to cover it up. But before going to that thing, let's have a brief overview regarding the blood supply of cerebral hemisphere as well as the brainstem, so that it will become very easier for us to understand the thing. So if we look at this one, cerebral hemisphere, this anterior cerebral artery, it supplies mainly a medial aspect of cerebral hemisphere, and this medial aspect in in motor as well as the sensory homunculus, this is the lower limb, right? The lower limb. So it means if there is anterior cerebral artery lesion, there will be lower limb getting affected. Similarly, the middle cerebral artery, it supplies mainly the the lateral aspect of the cerebral hemisphere. And the lateral aspect of the cerebral hemisphere is the one which in motor homunculus as well as the sensory homunculus involves upper limb and face, right? So if there is any lesion of the middle cerebral artery, upper limb and face will get affected. And posterior cerebral artery, it supplies mainly the posterior most aspect or the inferior aspect of the cerebral hemisphere. So it's very easier to remember. The posterior cerebral artery, mainly there will be only one type, like say we can say the one symptom, characteristic symptom, that will be if this part is getting affected, there will be contralateral hemianopia. Contralateral hemianopia with macular sparing. Why the macular sparing? Because the part which is getting represented in the macula has got the dual blood supply. If there is lesion within the posterior cerebral artery, middle cerebral artery, blood supply is intact, so there will be macular sparing. So it's very simple for the posterior cerebral artery, but with respect to the anterior and middle, we will discuss in coming slides. Now, if we look at this from the lateral aspect, the same thing. This supplies the lateral surface. This is the middle cerebral artery, and which represents our upper limb and face, right? And if we look at the medial aspect, the anterior cerebral artery, this supplies the anteromedial, this part, and this represents our lower limb, right? And the posterior cerebral artery is the posteriormost and the inferior. Now, blood supply of the brain stem. We should focus only few of the arteries. One is the anterior spinal artery. The other one is the posterior inferior cerebellar artery. The third one, anterior inferior cerebellar artery. And the fourth one is basilar artery. Mainly the questions are asked based on any of these four arteries getting affected. So if we look at these things, say this is the brainstem part starting from, because below that there is a spinal cord, right? So if we look at this thing, this anterior spinal artery, this one, anterior spinal artery, and the posterior inferior cerebellar artery, this is mainly the medulla part, right? The lowermost part of the brainstem is the medulla. And even in this medulla, if we look at this one, anterior spinal artery, this is involving mainly the medial aspect. So if there is a lesion in the anterior spinal artery, there will be medial medulla getting affected. Or if there is lesion within the posterior inferior cerebellar artery, this is the lateral aspect of the medulla. So lateral medullary syndrome in posterior inferior cerebellar artery, and medial medullary syndrome we will get in anterior spinal artery. We will talk about this thing in detail in the coming slides, but to understand like why anterior spinal artery is medial medullary syndrome and posterior inferior cerebellar artery is the lateral medullary syndrome. Now above that there is pons, right? So mainly if this anterior inferior cerebellar artery, it is supplying, this part is pons, right? Say I'll change the color. This is pons. This entire thing is the pons. This pontine artery, it supplies mainly the medial aspect of the pons, and this lateral aspect of the pons is supplied by anterior inferior cerebellar. So anterior inferior cerebellar artery lesion will result into lateral pontine syndrome. Okay. Similarly, the posterior inferior cerebellar artery lesion will result into lateral medullary syndrome, because they are mainly supplying the lateral aspect, and anterior spinal artery will result into lesion in the anterior spinal artery, medial medullary syndrome. These three things, they are very important, and most of the questions, they are based around these three things: anterior inferior cerebellar artery, lateral pontine; posterior inferior cerebellar artery, lateral medullary syndrome; anterior spinal artery, medial medullary syndrome. Now we will discuss about the symptoms, which collection of the symptom is known as lateral medullary syndrome or the medial medullary syndrome in the coming slide. Okay, so now coming to this part, we covered the anterior circulation, middle cerebral artery, anterior cerebral artery, and one more artery there, that is the lenticulostriate artery. In the posterior cerebral artery, we will focus on, in the posterior circulation, we will focus on anterior spinal artery, posterior inferior cerebral artery, that is the pica; anterior inferior cerebral artery, that is the ica; basilar artery, and posterior cerebral artery. So first, we will cover anterior circulation. In anterior circulation, first and foremost is the middle cerebral artery, which supplies mainly the lateral aspect, right? The lateral surface of the cerebral cortex. So the three main area which is supplied by the middle cerebral artery is motor and sensory cortex on the lateral aspect, and lateral aspect is the one which represents upper limb and face. So because there is a motor cortex involvement, there will be the paralysis. Because there is also the sensory cortex involvement, it means sensory loss. So paralysis and sensory loss of the upper limb and face of contralateral side, that will be the one symptom, right? And if we look at this one, like say, just imagine the lateral aspect of the cerebral hemisphere. So it is mainly constituted by the temporal lobe and the frontal lobe, which has got the middle cerebral artery blood supply. So there will be involvement of the temporal lobe. If it is dominant side, which is usually the left side, there will be aphasia. And if we can recall, temporal lobe is where there is Wernicke area located. So there will be Wernicke aphasia. If non-dominant or the right-sided middle cerebral artery is getting affected, then on the right aspect of the temporal lobe, that lesion will result into hemi-neglect. And within the frontal lobe, Broca's area is getting affected. So the person will have three symptoms in middle cerebral artery syndrome or middle cerebral artery lesion. One, loss of sensory as well as paralysis of the upper limb and face of contralateral side, opposite side. That's the one. Second thing is, if there is left-sided middle cerebral artery getting affected, then there will be Wernicke aphasia. If the right middle cerebral artery is getting affected, there will be hemi-neglect. And the third one is Broca's aphasia. Now, Wernicke and Broca's aphasia, we are very well aware, like in the Wernicke aphasia, what happens? The patient who suffers from the Wernicke, that is the receptive aphasia, right? Receptive aphasia means the person don't have insight. There will be the word salad, and whatever he will be saying, it will make no sense. And Broca's aphasia means the person who suffers from this one will have intact insight but won't be able to say the word. So if we get any kind of the, like say, if we are getting a question or vignette in which the patient presents with say left-sided upper limb and face getting paralyzed, as well as there is loss of the sensation, and the person is not able to understand what the question is being asked or is not able to answer the question, then your, like say, pinpoint diagnosis should be middle cerebral artery is getting affected. As well as, because within the temporal lobe, if we can recall, there is Mayer's loop going, right? Which is the lower part, which represents the lower part of the retina. It goes to the occipital cortex. Occipital cortex. So, lower part of retina means in the field vision, upper part, upper quadrant novia, that is known as the pie in the sky in the contralateral aspect. Okay, contralateral aspect. So, in conclusion, we can say the middle cerebral artery lesion will have contralateral upper limb and face paralysis as well as sensory loss. That is the one symptom. The other one is Wernicke aphasia, and the third one is Broca's aphasia. So, not making it too complicated, just remember aphasia and contralateral face and upper limb paralysis and loss of sensation. So, your diagnosis should be most probably middle cerebral artery. Now coming to the second one, the anterior cerebral artery. Now the anterior cerebral artery, as we know in the previous slides, it represents or it supplies the medial aspect of the cerebral hemisphere, like this aspect. So the motor and sensory cortex, which represents medial one, the lower limb. So there will be the lower limb paralysis, as well as there might be the person suffering from urinary incontinence. So it's very easy to remember, like say, kind of mnemonic you can say, the person who suffers from the anterior cerebral artery lesion is not able to pee anteriorly, like we can say the stream of the urine won't fall anterior, right? Won't fall anteriorly. It will be falling on the lower limb itself. So the lower limb is getting affected and the person is not able to maintain the continence of the urinary. There will be the wetting of the lower limb. So lower limb paralysis as well as loss of the sensation too will be there because both the motor and sensory cortex is getting affected. That is the anterior cerebral artery. Now coming to the third one, lenticulostriate. This is the most common. Most of the patients who suffers from the stroke, they get affected by the lesion within the lenticulostriate artery, and it supplies striatum and internal capsule. Striatum is caudate and putamen. That is the basal ganglia, right? These basal ganglia thing, and the internal capsule is getting affected. So in this one, who suffers from the lesion of the lenticulostriate will have contralateral paralysis. Contralateral half of the body paralysis will be there. And there won't be any cortical sign as it was in anterior cerebral artery and middle cerebral artery because the cortex is not getting affected. So there won't be any neglect, there won't be any aphasia, there won't be any visual field loss. So lenticulostriate artery lesion will affect striatum and internal capsule. So there will be contralateral paralysis. So that's why it is also known as pure motor stroke. No sensory symptom, only motor paralysis. So if in a question, the patient presents with one half of the body complete paralysis, then you should suspect that that person is having lenticulostriate artery lesion, in fact, within this one. And this is quite common. There might be a history presentation, like a person who suffers, who is having chronically hypertension and which is unmanaged or uncontrolled. The patient is not on any antihypertensive medications. So definitely it will result into the lacunar infarct in this particular area due to hyaline arteriosclerosis. That is also known as lipohyalinosis. So your diagnosis should be for the question chronic hypertensive patient who is not regularly taking antihypertensive medication present to the emergency ward with one half of the body paralysis. So you should pinpoint your diagnosis as lenticulostriate artery. So now we can say anterior circulation, middle cerebral artery, anterior cerebral artery, and lenticulostriate artery. So in middle cerebral artery, there will be involvement of face and upper limb, right? Face and upper limb. In anterior cerebral artery, lower limb. And in lenticulostriate artery, pure motor paralysis of contralateral half, right? So that is a lenticulostriate. Middle cerebral artery, face and upper limb, both the paralysis as well as sensory loss in contralateral side. And in this one, anterior cerebral artery, contralateral lower limb paralysis and sensory loss. Along with anterior cerebral artery, lower limb, we made some mnemonic kind of thing, urinary incontinence, right? And in the middle cerebral artery, there will be aphasia. It can be Wernicke aphasia, it can be Broca's aphasia, or it can be both. If it is on the dominant side involvement. If it is the opposite side, then there will be hemi-neglect, right? Hemi-neglect. Hemi-neglect. There, in some of the patients, there might be pie in the sky visual field loss. So that's very easy to remember. Middle cerebral artery, face, upper limb, paralysis, and loss of sensation contralateral opposite side. Aphasia and hemi-neglect might be there, might be pie in the sky kind of vision loss. In anterior cerebral artery lesion, lower limb contralateral opposite side, having sensory loss and paralysis as well as urinary incontinence. In lenticular striate artery, which is quite common, there will be pure motor paralysis of contralateral opposite side of the entire body. Now coming to posterior circulation. In the posterior circulation, first we will talk about the anterior spinal artery. And if we can recall where the anterior spinal artery, it mainly supplies the medial aspect of the medulla, lowermost part of the brainstem. So that's why the lesion within the anterior spinal artery will result into medial medullary syndrome. Medial medullary syndrome. Now within the medial medulla, what all the tracts are crossing that medial medulla so that they will get affected? One of them is corticospinal tract. The other one is medial lemniscus. The third one is in the caudal medulla, cranial nerve, 12 nuclei. So there will be symptoms which affect the corticospinal tract. Corticospinal tract, it means there will be paralysis and there will be opposite side, contralateral paralysis of upper limb as well as the lower limb because of the entire half of the body, right? Medial lemniscus, what is the medial lemniscus? It is just say the posterior column ascending pathway, like the spinothalamic tract, posterior column or dorsal column, when they cross over in the medulla and move to the opposite side, then they traverse along the medial aspect, that is the medial lemniscus. So it means there will be loss of the sensation which are carried via the dorsal column from the opposite side of the body because they have crossed over. And dorsal column, if we can remember our physiology part, this dorsal column or the posterior column tract, ascending tract, they carry the sensation of proprioception, joint position, vibration. So the patient will have reduced proprioception, joint position or vibration from the opposite side of the body. And the third thing is cranial nerve 12th, hypoglossal nerve getting involved. So ipsilateral, same side, tongue will get deviated. So the person who suffers from the anterior spinal artery lesion will affect the medial medulla, which is known as medial medullary syndrome, and this is the triad of medial medullary syndrome. What are those triads? The triad are contralateral, half of the body getting paralyzed, contralateral, dorsal column, sensation lost, proprioception, joint position, vibration sensation lost, and ipsilaterally, tongue will be deviated like this side, paralysis as well as loss of position sense, joint position sense and vibration, and tongue is getting deviated toward the side of the site of the lesion. That is the medial medullary syndrome. It is caused by the infarct of paramedian branches of the anterior spinal artery. Some of the cases might have vertebral artery. Okay. Now coming to the second most important one, the posterior inferior cerebellar artery. Now the posterior inferior cerebellar artery, it was supplying the medulla. Which aspect? The lateral aspect of the medulla. So that's why it is known as lateral medullary syndrome. Or it is also given the other name, that is a Wallenberg syndrome. The mnemonic for this one is PICA, pica. So don't pick don't pick a horse that can't eat. So can't eat is dysphagia. Horse is hoarseness of the voice. Pick and means pica, for the pica. So if there is a lesion in the pica, there will be hoarseness, there will be dysphagia. If we can recall back, anterior inferior cerebellar artery, not the anterior inferior, the anterior spinal artery, the anterior spinal artery, which was resulting into medial medullary syndrome. Which cranial nerve are there? 12th. Now above the 12th, 9th, 10th and 11th, they are located in the lateral aspect of the medulla. So they will get affected. When this 9th, 10th, and 11th cranial nerve is getting affected, there will be hoarseness, dysphagia, right? Hoarseness will be there, dysphagia will be there will be reduced gag reflex will be there because of the involvement of 9th, 10th, and 11th. There will be vomiting, vertigo, and nystagmus that patient might have these seizures because the vestibular nucleus is getting affected. Vestibular nucleus. Now, what about the sensillose? Lateral spinothalamic tract. Lateral spinothalamic tract is getting affected, and lateral spinothalamic tract is the one which carries the sensation of pain and temperature. So there will be loss of the pain and temperature of the contralateral body and ipsilateral face. Some of the sympathetic fiber, they might get affected of the same side, which will result into Horner syndrome. Horner syndrome is ptosis, meiosis, and anhidrosis of the same side, right? So these symptoms. So a person who presents to the emergency with dysphagia, hoarseness, reduced gag reflex, vomiting, vertigo, nystagmus, loss of pain and temperature in the contralateral aspect of the body, opposite side of the body, but on the same side of the face, and there is ptosis, meiosis, and anhidrosis on the same side of the face, right? Then you should suspect that that person is suffering from pica, posterior inferior cerebellar artery lesion, or lateral medullary syndrome, or Wallenberg syndrome. Okay, Wallenberg. Actually, I tried to memorize during my NEET PG exam days. Like say Wallenberg, W is upside down of the M, so it is medullary, and there is Wellen, double N, so lateral medullary. It might sound quite stupid, but that's how remembered it. Like Wallenberg is lateral medullary syndrome and pica. So in short, we can say pica don't pick a horse who can't eat. So hoarseness, dysphagia, and immediately your mind can go like the hoarseness and dysphagia is 9th, 10th, and 11th cranial nerve. So there won't be any gag reflex too, right? What all other symptoms will be there? Corticospinal, lateral corticospinal tract. Lateral spinothalamic tract. So loss of pain and temperature in the contralateral body and ipsilateral face, right? So pica, hoarseness, dysphagia, contralateral body, and ipsilateral face, reduced pain and temperature, ipsilateral Horner syndrome, ipsilateral ataxia and dysmetria. Why? Because this pica, the posterior inferior cerebellar artery, as the name itself suggests, posterior inferior cerebellar artery, it supplies blood to the inferior cerebellar peduncle. So if there is involvement of the cerebellum, whether that is a part of the peduncle or cerebellar cortex, there will be ataxia and dysmetria. So all the symptoms of these cerebellar involvement, Horner syndrome, hoarseness and dysphagia of 9th, 10th, and 11th, and because of involvement of anterolateral spinothalamic tract, loss of pain and temperature, lateral medullary Wallenberg pica. Now, anterior inferior cerebellar artery. Anterior inferior cerebellar artery, it supplies blood to the lateral pons. That's why it's also known as lateral pontine syndrome. So lateral pontine syndrome is happening in the lesion of anterior inferior cerebellar artery lesion. And if we can recall back, anterior spinal artery, which cranial nerve nuclei? 12th. Posterior inferior cerebellar artery, 9th, 10th, and 11th cranial nerve. Anterior inferior cerebellar artery, cranial nerve, 7th. So the symptoms will be as that of facial nerve involvement. So the other mnemonic is facial droop if ica pooped. If a person's ica is getting pooped, there will be the facial droop. Now, what will be the symptom in the facial droop? There will be the paralysis of face, right? And in the paralysis of the face, because the facial nucleus is getting affected, so there will be lower motor neuron lesion of the facial nerve involvement. And what are those? There will be reduced lacrimation, reduced salivation, reduced taste from anterior two-third of the tongue, anterior two-third of the tongue. And the other symptoms will be same as that of, like say, posterior inferior cerebellar artery. There will be reduced pain and temperature of contralateral body and ipsilateral face, and there will be ipsilateral Horner syndrome, there will be ipsilateral ataxia. As in anterior spinal artery, cranial nerve 12th was getting involved, posterior inferior cerebellar artery 9th, 10th, 11th, anterior inferior cerebellar artery 7th. What about the 8th? The symptoms of the 8th will also be there in this one. And what are those symptoms which are present in this anterior inferior cerebellar artery lesion? Ipsilateral sensorineural deafness. So we can say now coming in conclusion, posterior circulation, anterior spinal artery lesion, posterior inferior cerebellar artery lesion, and anterior inferior cerebellar artery lesion. Okay. What was the anterior spinal artery lesion? It was lying medial aspect of the medulla. So medial medullary syndrome. Posterior inferior cerebellar artery, lateral part of the medulla. So there is lateral medullary syndrome. And in the lateral medullary syndrome, what was the other name? I'm upside down, that is what? And lateral Wallenberg syndrome. Wallenberg syndrome. And in anterior inferior cerebellar artery, this is the lateral pontine. Lateral pontine. That's the name. ASA is medial medullary syndrome, MMS. Pica is lateral medullary syndrome or Wallenberg syndrome. Pica is lateral pontine. What was the mnemonic for the pica? Don't pick a horse who can't eat. Hoarseness and dysphagia. So easily you should think about cranial nerve 9th, 10th, and 11th. So now we know about the pica, that is the lateral medullary, 9th, 10th, and 11th. Anterior spinal artery is 12th cranial nerve feature, and anterior inferior cerebellar artery is 7th and 8th. Right. Now, what were the symptoms in the anterior spinal artery lesion? There was contralateral paralysis, corticospinal tract involvement, contralateral paralysis of opposite side of the body, right? And what was the other thing? There was contralateral loss of joint position, vibration, right? And what was the third one? Tongue was deviated toward the site of the lesion. Tongue was deviated toward the site of the lesion. All these features, these three things, you should just focus on this. It is anterior spinal artery lesion. In pica, 9, 10th, and 11th, there will be the dysphagia, hoarseness. What other symptom will be there? There will be loss of pain and temperature in contralateral body and ipsilateral face. In ICA, you just focus on the symptom which are regarding the facial nerve, right? Facial nerve involvement and this one, sensory neural deafness. So if in a question there might be say 7-8 sentences, but if you get hold of the facial nerve feature and this one 8th one, like there is some reduced salivation, lacrimation, anterior two-third of the tongue, and sensory neural deafness, just focus on anterior inferior cerebellar artery or lateral pontine. Now, one more artery, that is the basilar artery. If there is a lesion of the basilar artery, the person will suffer from locked-in syndrome. So the mnemonic for this one is locked in. The person who suffers from basilar artery lesion has been locked in the basement, right? Just imagine a person who has been locked in the basement. So what that person will do, that person will be looking upward for any kind of the help that's coming from the upper floor because he is locked in the basement membrane. So there will be loss of the horizontal eye movement but presence of the vertical eye movement. Vertical movement of the eye will be there, and because it is locked in, that person is not able to move anything, so there will be the quadriplegia. So easier to remember is quadriplegia. Just imagine a person who is locked in the basement, not able to move any limb, whether it's the upper or the lower, quadriplegia, and looking upward for any kind of the help. So there will be vertical movement of the eye, but loss of horizontal eye movement. So that's the basilar artery. That's all. Thanks.